Hi guys, so Boris Johnson delivered a speech yesterday about the new vaccine, the rollout of it, and of course he handed over to the experts. Here you're going to hear from Jonathan Van-Tam, who's the Deputy Chief Medical Officer. He's going to explain some of the requirements of the vaccine, how it's going to be rolled out, but he's also going to talk about how it's important that people take it. Now, there are some serious issues with the rollout, there are some serious issues with convincing people, and I'll explain that in a moment. So let's hear what he had to say about this.
Number 3, we need people to take it. This vaccine isn't going to help you if you don't take it. And you will need 2 doses of this vaccine and most of the others to have full protection. Watching others take it and hoping that this will then protect you isn't going to work necessarily. We don't know if this vaccine will prevent transmission or any of them. We have to wait for the science to tell us if it will prevent transmission, though we are very hopeful on that point. We also have to be patient to see the real live effects on transmission and hospitalisations and deaths. And until we see that as scientists, we can't then scope what the likely impact is going to be on bringing this pandemic to an early end. And rollout won't be instant. Already on the JCVI phase 1 list, we have round about 30 million people who are going to be targeted at some point. And even if you gave me 60 million vaccines here in this corner now, in a freezer, of course, but if you gave me the 60 million, I couldn't, no system in the world could distribute those really, really quickly in a matter of a few days. So we have to be realistic about how long this is going to take. It's going to take months, not weeks.
Okay, so I think there are a number of issues to talk about here. And the first one I want to talk about, of course, is trust. Now, he has said that people have to take it. People will have to take this vaccine. You cannot be protected by other people taking it. You cannot be protected by being close to people, other people who have taken it. You will have to take it. Now, what is the problem here is that the problem is not with the vaccine itself, although some people will say that there is. But my issue in this video is not about the vaccine. My issue is with public trust. You've had a government, and a previous government before that under Theresa May, but this government under Boris Johnson has completely degraded any level of public trust that could have existed. What I'm talking about is they have lied to the public regarding Brexit, regarding universal credit, regarding almost any issue. It's all it was about protecting the government. So they've lied to people. Now, they've made promises, whether, I don't know, whether in some cases, I don't know whether they actually believed that they would be able to deliver it, or they really just didn't care. But in both cases, this degrades, this reduces public trust. And you need the public on your side if you want to deliver this vaccine. You need people to come out to trust the government. Once again, I'm not criticizing the vaccine. I'm not a scientist, so I'm in no position to do that. But what I'm doing is I'm observing how the government has treated the public over the last number of years, under Theresa May, under Boris Johnson, on a wide range of issues: Brexit, universal credit, the NHS, infrastructure, Scotland, education. All issues, they have a very low approval rating. People don't trust them. And now, when it's really important that that ordinary people, the citizens of the UK, trust their government, I don't think they're going to do that. And it's going to make it much more difficult to deal with this pandemic, because you need a certain level of trust to exist between the citizens and the government. And Boris Johnson has destroyed all of that because he wanted to protect his party and he wanted to protect himself. Now, on the issue of the rollout, I think it's very important, and Van-Tam was very clear here. Even if he had 60 million vaccines sitting in a corner or sitting in a freezer, as he said, you can't roll these out immediately. You need infrastructure. You need facilities to do this. You need logistics. And I think this is going to be a huge difficulty for the government. I've said in another video how in care homes, it's not just a matter of lining people up and, distributing this vaccine. You need care home workers to move to the patients, to move around the building, maybe numerous sites. They have to transport these vaccines from one site to the other. And there is a risk that the quality could degrade as it's moved around. Many care homes don't perhaps have the facilities available to store these types of vaccines. This is another issue. But at the end of the day, I think the two main issues are public trust and the logistics. Now, the logistics is something they can overcome. The logistics, as far as I see, is going to be dealt with by the military. Get the army involved. They have the resources available. They have the manpower. You have a very organized structure there. There isn't going to be much confusion. Once the soldiers know what they have to do, they'll follow orders, and that's their job. And I think the rollout, if you hand it over to the military, will be efficient and without many serious issues. The problem is public trust. And I think this is something that's going to clearly undermine how this vaccine is rolled out. Once again, I hope people will take it. I'm going to take it because I think it's part of our civil duty to take it. I understand people have concerns because it was rushed, and maybe those are valid concerns. Here in Italy, there is general, at the moment at least, there is a certain amount of trust between citizens and the government. But I fear in the UK and also in other countries where there is a right-wing government, not in all cases, but generally, there's not a huge level of trust between citizens and the government. And of course, I understand people not trusting Boris Johnson, not trusting his cabinet, Matt Hancock, and the government in general. But we need people to get on board. We need people to take this vaccine. Otherwise, we're going to see more lockdowns. We're going to see more restrictions. We're going to see this problem continuing into 2021 and beyond. That's all I really have to say about it. I think, it's very positive that we have this vaccine. We need to start rolling it out. We need to protect as many people as possible. Of course, frontline staff, care home staff, and members of the care homes. But I do feel that public trust has been eroded a great deal. I'd love to know what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.